everyone, welcome back to my channel. This is Pindi Maseko. Welcome back to my channel, guys. I just want to thank everyone that is supporting the channel. We are growing in this channel because of your support, so I just want to thank everyone that is subscribing and the ones that are commenting. Thank you very much, guys. I just want to welcome you again. If you are new in here, please don't forget to subscribe and don't forget to hit the like button so that we can you can be notified whenever I upload a new video. So before we start our topic today, we've got a new topic of the week or topic of the month. So I just want to say please don't forget to subscribe and hit the like button. I just want to emphasize that. So, and to those who didn't watch our previous video, can you please go to our previous video so that you can have the background of our topic of today. So last time we were talking about importance of antenatal visit, and on that topic I even emphasized that we've got the risk factors that we can be identified when you are visiting our antenatal visit, or when we are doing the basic observation, we can detect any problem or abnormalities or any risk factor. So today we've got one of those risk factors, which is PIH. PIH is pregnancy-induced hypertension. I'm sorry, guys. It's pregnancy-induced hypertension. We call it PIH. So I can try to explain that, but we've got topics that we have to cover after or during our topic or during our lesson. So can I just say at this point we are going to talk about the causes of PIH. We're going to talk about the symptoms, the types, prevention, risk factor, and difference between PIH and pre-eclampsia. So guys, I've got my diary on my left hand side, so I'm going to be like looking on my left hand side so that I can check the point. I don't want to left any point hanging. And please don't forget that I'm not an expert, I'm not a professor. I'm giving health education with the information that I have, with the information that I inquire, since I am a nurse and I am a professional nurse. I'm not here to advertise any department. I'm not here to advertise any product. I'm here to give information and health education. I've got my own private practice, which is Katlulo Health Services. We are in Barberton, 68 Crown Street. So you can call for appointment, you can WhatsApp for appointment, or you can seek for any information or clarity, and we are doing home visit per request. So we can start our topic now. Yes, since I've said our topic, it's PIH meaning that pregnancy-induced hypertension, and then I just want to explain this before we can go on the difference between pregnancy-induced hypertension and pre-eclampsia. And then pregnancy-induced hypertension is a rise in blood pressure. It can be more than 140 of systolic and more than 90 of diastolic. And when we do the urine analysis, we can find out you don't have protein in your urine, and that one is a hypertension that is developing during the pregnancy. That is why we are calling it PIH. And then when we are doing the blood pressure, your blood pressure, the systolic it's more than 140 and the diastolic it's more than 90. And when we do the urine analysis, we find that your urine has got protein, meaning that you are developing pre-eclampsia. That's the difference. and then we can continue. I think we can understand the difference between preeclampsia and the pregnancy-induced hypertension. And pregnancy-induced hypertension, it's a very, very high risk for a pregnant woman, because if you have diagnosed with PIH or diagnosed with preeclampsia, we have to attend the high risk clinic. It can be in your private practitioner, or it can be in the hospital. You are no longer supposed to go to the clinic because you are a high risk. You can go to the clinic for the normal checkups, but you are follow-upping your pregnancy in high risk clinic. So we've got factors that can or the causes that can cause gestational high blood pressure. But for now, we are saying the causes of hypertension in pregnancy, it's unknown. But we do have factors that can cause, factors that can increase the pregnant woman to develop PIH. It can be kidney diseases, the pre-existing kidney disease that we have before you fall pregnant. That one, it can be a high risk factor. And we can say the pre-existing hypertension, the hypertension that you have been diagnosed before you fall pregnant, is the one that it can be a high risk for you to develop hypertension. So we've got symptoms of a pregnancy-induced hypertension, or symptoms of gestational hypertension. Symptoms is the signs that when you can see or what is happening in your body, that you can see that now I'm developing the PIH. It can be a headache that doesn't go away. Remember, we are dealing with a pregnant woman, and the pregnant woman is complaining of the headache each and every time when she visits the clinic, or each and every time when we're at home. You can even see that I've got this headache. You take analgesia, it doesn't go away. That one, it's one of the signs that says you are developing PIH. And you can have edema, or you can have swelling of lower extremities, and you can think of, no, it's because it's hot and that's why I'm swelling. No, that's one of the signs of developing high PIH. And you can have the sudden weight gain. We understand that you are having a fetus in you, and you are sometimes some of the mothers, they have more appetite, so they eat, so they gain weight. But you must just check on that. The gaining of a weight, it mustn't be rapidly, like you don't understand what is happening. So if you are rapidly gaining weight, that is a sign of developing PIH. And you can have nausea, or you can have vomiting, and you can have a change in vision, or you can have a blurred vision or double vision. That one is also a sign. And then you can have, remember, you can even producing small urine. But remember, you've got fetus, and I forgot to state this. The PIH, usually it can be picked up during your first 20 weeks. So the fetus is not that big, you can press the urethra. But now when you are producing less amount of urine, and the baby is not big, you can press the urethra, meaning that there's a problem in your system. There's a problem in urine. Remember, we said we can see the protein in the urine, so we have to check on that. That is also a sign. So you can have a pain upper right side of your stomach, or upper right of your belly, or after upper right of your stomach, you can have a pain. You can just see that. And if you've got those signs, one of the signs, you must just not wait to have 2 or 3. One of these signs, go to the clinic, go to your practitioner and report, so that the practitioner or the sisters in the clinic, they can make sure that they rule everything out, they check, they do all the tests based on your report. That can be prevented. And then we do have the types of blood pressure. Remember, we've got pre-eclampsia, as I've said before, and we've got gestational hypertension, and we've got chronic hypertension, and we've got the BP that developed before your pregnancy. That's the type of blood pressure that we have in PIH. And we've got the prevention of high blood pressure in a pregnancy, or we've got prevention in PIH. You can call it vice versa. It's understandable. So we've got prevention of pregnancy-induced hypertension. So one of them, you have to get a rest, enough rest. If you are pregnant, you know, some of the women, they work, they've got some duties at home as mothers, they have to take care of the family and the other siblings. But we have to make sure that you get rest at the end of the day. Enough rest, so that you can prevent some of the complication. And you have to do regular exercises. And another one, you have to elevate your feet several times. You have to elevate your feet. When you are sitting, you must only leave your feet hanging. You must just make it a point that you put a pillow on underneath, or you put on top of a chair, and then you put a pillow to support. And then you must just drink at least 8 glasses of water, not 8 liters, 8 glasses of water a day. So, and remember, you have to increase protein in your diet, and you have to reduce the fried food, not to stop. I'm saying you have to reduce the fried food, because some of the pregnant women, they can say, Mina, I've got this craving of fried food or whatever things, the slab chips and whatever, but you can eat, but make sure that you reduce, because we want to prevent to develop the PIH. And then we've got these causes of gestational hypertension. And then we've got number one, we've got diabetes mellitus. Remember, if you have got diabetes mellitus, it's a chronic thing. So if you are chronic with diabetes mellitus, that's the risk also to develop hypertension in pregnancy. And if you've got previous hypertension in your pregnancy, the previous pregnancy, you were diagnosed with hypertension, so that also a risk. You can even be being diagnosed again with that hypertension in pregnancy. And the mothers that are younger than 20, they likely develop pre-eclampsia, and the mothers that are advanced, the more than 40 years of age, they usually develop PIH also. And we've got risk factors for chronic hypertension, and then that include the advanced maternal age, the over 40 years of age, the obese, of BMI of greater than 30, and the renal disease, and type 2 of diabetes mellitus, and gestational diabetes mellitus. Gestational diabetes mellitus is where they diagnose you with diabetes during your pregnancy. We call that gestational diabetes mellitus. You were not diagnosed with diabetes mellitus before the pregnancy. Now you are pregnant, and then when we do the basic observation, we do the pricking, and we check your glucose. We find that the glucose is very high. It's where we're going to diagnose you as gestational diabetes mellitus. So yeah, guys, it's what I was having for you today. I just want to thank everyone that was listening and everyone that was watching. I just want to encourage each and every mother, or each and every women who is pregnant, or the mothers that they wish to fall pregnant, just to make sure that they do everything right. You visit your antenatal according, and you monitor yourself, you monitor your pregnancy, to check the signs, to check the symptoms when you're at home. And if you can find that you've got at least one sign, go and report to your practitioner, go and report to your clinic sister or your doctor or your practitioner, so that they can make sure that they prevent that, they monitor that. Thank you very much for watching. Please don't forget to subscribe and hit the like button. And please guys, you can even comment and tell us which topic do you want us to tackle, or which topic do you want us to talk about, and I will appreciate that. Thank you very much and enjoy yourself. Thank you. Bye.